The views and opinions expressed on this program are those of the participants and do not reflect the views of BronxNet or the program underwriters.
BronxNet. Your voice, your views, your vision.
Good evening and welcome to BronxTalk. Well, it wasn't too long ago that HIV and AIDS was the healthcare talk of the borough of the Bronx. It was a plague that rocked many of our neighborhoods. But simultaneously, with available new treatments and continuing emergency numbers in other health indicators, like diabetes in particular, concern over HIV and AIDS has moved off the front pages. But that doesn't mean there still aren't people who are infected and need attention and support. Tonight's guests are also concerned that the City Council and Bloomberg administration have conspired to deprive the borough of the Bronx of life-giving federal funding. So we have a lot to talk about as we get through World AIDS Day, which is this week, December 1st. First, you are welcome to join us on the telephone tonight. You can call 718-960-7241. You can also email questions or comments to us at bronxtalk@hotmail.com, and we'll read those on the air during a future edition of our program. But for now, please join me in welcoming the Chief Operating Officer of the Bronx HIV Advocacy Network, Roberto Johnson. Good evening, Mr. Johnson. Thank you for joining us.
Thank you.
And also from Health People, it's Chris Norwood. Welcome back to BronxTalk.
Oh, thank you, Gary.
Mr. Johnson, let's start with you. Give us a status update. As I introduced there, maybe some people say, oh, it's an old problem. We don't really have this problem anymore. Do we have this problem in the Bronx, and how big is it?
We do have this problem, and we've made some strides, but there's still a lot of work to be done. As the Chief Operating Officer on a volunteer basis for the Bronx HIV Advocacy Network, I am delighted to say that we have done a lot of work in this community, and thanks to our founder and CEO, which is Mr. Socrates E. Kaba, this is a grassroots organization that started in the Bronx 20 years ago, and he's been working hard to make sure that people get the help they need. However, there's still a lot of work to be done.
Busier than ever before?
Busier than ever before, yes.
Busier than ever before. I want to be very clear about
because
that.
there are a lot of changes, there are a lot of cuts back and forth, but we try to be creative and make sure that we provide that support and the needs that people, to collaborate with people in the community, yes.
Ms. Norwood, we'll let you throw some numbers at us. You got an idea of characterize the size of the problem. We still have it better than it was. It's worse. Give me some characterization.
Well, obviously, in some ways it's better because of the medications. People are living longer. But overall, the Bronx adult population has a 2% HIV rate. Under UN guidelines, is considered a general epidemic.
2% is considered a general epidemic.
For HIV, yes. It's the highest rate, I think, except for Washington, D.C. in the country. And also because in the Bronx, the numbers for women and men are quite close. You have AIDS really is a family problem. The borough unquestionably has the highest per population level of kids who have either been orphaned or who are living in families where the parent have AIDS. And that, that requires extra consideration and support.
Mm-hmm. I presume you agree at least somewhat with the way I introduced the program, saying that, it's not on the front pages, but it's very much a problem. Give me a comparison to maybe what the problem was 10 or 12 or 15 years ago, maybe when we first did it on this show, to where we're at right now.
Well, the overall infection rate was similar, but people were dying so much faster.
Because we didn't have the treatment.
Because we didn't have the treatment, or the effort hadn't been made to get people in the treatment. I have to say, one thing that you also mentioned in the introduction was the funding. In the last years of the Giuliani administration, We had something called the 718 AIDS Coalition, obviously named after the area code.
Of the outer boroughs.
Of the outer boroughs.
So-called outer boroughs.
Other boroughs. And the Giuliani administration actually responded to this because the city gets $110 million a year in extra AIDS money from the federal government year after year. And this is supposed to give extra help to the poorest, high-need areas. And at that time, most of it had been in Manhattan, but we got it, spread around fairly evenly to the boroughs. And you could see the death rates in the Bronx and Brooklyn, which are the poorest boroughs, started coming down even faster.
Between what years?
This was from 1998 to 2006. And then this administration, the Bloomberg administration, began, they did 3 what I call major recontracting. This is millions of dollars at a time. And each time, they took more and more money out of the Bronx and Brooklyn and gave it to Manhattan agencies, even though now 67% of poor people with AIDS who are supposed to be receiving this federal money are in the Bronx and Brooklyn. They have ended up contracting 60% of the community support money to Manhattan agencies.
Why did that happen?
I think it happened as an expression. I'm going to try and say this, simply and not...
and gently? Is that
and
what
gently, yes.
Although it is a Bronx talk show, you could say what you
okay. I think it...
Be blunt.
Yeah, I think it expresses a contempt that administration has.
For the Bronx? For sick people?
For people who aren't in Manhattan. They had a special AIDS commission that they appointed. It was all people from either Manhattan or government entirely to make plans for the city. And when a lot of Bronx agencies got together and wrote and said, why don't we have representation on that? The health commissioner wrote back.
When was that?
That was in 2005, and that's how this started. The health commissioner actually wrote back on, that was sent to the mayor sent it to the health commissioner, on city stationery, signed with his name, that this was an elite commission not meant for all subpopulations. So he was defining the entire Bronx as a subpopulation, no matter who, Wouldn't even appoint, say, a major doctor from the Bronx to that commission.
Let me bring Mr. Johnson into at least a dialogue about advocacy. Why is it so difficult now, leaving the politics aside and the Bronx versus other boroughs aside, but just in general, why is it so difficult now to advocate for funding for AIDS, to indicate that, this is still a very big problem?
Well, the advocacy problem, it's a situation wherein that there's limited, according to the states and city officials, there are limited resources. So in terms of the advocacy, in our case, as the Bronx H, we advocate for consumers rather, and we try to create a collaboration between consumers and providers. Mm-hmm. It's more challenging now. It's a little more challenging because the complexity of the lack of resources and lack of fund, but there's still opportunity out there for advocacy. That's what I see.
I mean, I guess going back to the way I introduced it, if you were to say now, gee whiz, we've got a program to fight obesity or diabetes, and certainly asthma has been on the radar in the Bronx for many, many years. Sure. My sense is that you would probably do better than right now if you say, well, we need funding for people with HIV. And this is apart from the concerns you raised. Sure. But I'm just talking in general. It would seem to me that would be a more difficult thing to raise because of the sense that I pointed up at the top. You know what? So we got that covered. Don't we have, right? Am I characterizing that properly?
Well, what I want to say about at the Bronx HIV Advocacy Network, we advocate for our consumers. That's what I'm going to say. And the fact of the matter is, despite the limited resources, we try to be creative, working with agencies, city agencies. We develop these forums on a bi-monthly basis. Why? Because we get information from our consumers saying what they like, what they don't like, what they need, and the gaps.
So it sounds to me like you're very much, and your organization is a half full conceptually. This is what we've got. We're just working with what we got, as opposed to some kind of the edgier stuff that we're getting from your co-guests.
We all suffer from the lack.
Fair.
We all suffer from the lack of opportunities and resources.
But your thing is, this is what we've got, and we're really going to work with it.
We try to be creative with whatever we have. Unfortunately, we know that there are major cuts out there, but we still move on and try to be creative and make sure we get whatever necessary for our consumers.
So again, back to you, Ms. Norwood. So this is a budgetary consideration that, and I mentioned the City Council to start, and the Bloomberg administration. Where is that? Is there a dialogue about it, or is it essentially off the table at this point?
Well,
and is the City Council involved, and is our council delegation involved, et cetera, et cetera?
I don't think the council delegation has fought hard enough about this at all.
For the reasons that I have articulated, that maybe they're not aware that it's as big a problem as it is?
Everyone's aware. I mean, that's why when you try and get up and talk about it, people call the police. But I have to emphasize, this money the city only has because of its total AIDS cases. So if they're not putting this money in, fair share, it's like they're using sickness in one borough.
Let's just say there's 100,000 AIDS cases. I don't know how many AIDS
true.
cases there are. Okay, how many AIDS cases?
There's 100,000.
There are 100,000 AIDS cases, which is a rather extraordinary number.
Yes.
Okay, if there's that many AIDS cases, that's the basis on which the funding comes. And what you're saying is the distribution of those funds are not going to where the larger populations of those 100,000 are dispersed in the outer boroughs, so-called outer boroughs of the Bronx, Brooklyn, and Queens.
And in particular, this particular money is meant for high-need areas where there's poor people who need extra services. So it's even more badly distributed because the majority of poor people with AIDS live in the Bronx and Brooklyn.
You brought a chart, which I have here, and maybe they can put that up on the screen. And so the effect that you're alleging through this inequity is that a larger percentage on the right-hand side, I don't know if people can see it, but on the right-hand side are the percentage of the deaths due to AIDS in the city of New York between 2005 and 2009 has gone from 23.6% to 28%, and at the same time the funding on the left side has gone down as a result of this. Now here's my question to you about this. How do you know that one is a result of the other, and there may not be other factors causing this rather unfortunate statistic?
Well, a couple of reasons. One, because this kind of local support has been shown over and over. If you have a local support group that people go to, that keeps them in care. Equally, I studied the years before they started moving this money, and the death rates were going down equally in the Bronx, Brooklyn, and Manhattan. Going down equally. Now they're not. And people, how shall I say, that was, quite extraordinary. Right. Because they have different profiles of health, different profiles of population. But once, it's not just the money's distributed, it's how it's used. And especially in the outer boroughs, like I run what's called a peer education program. We train local people as very highly trained volunteers. They have to take a 10-day-a-week, 4-day-a-week training. When you do that, you can put 20 support groups in a small area and really get people into services.
But without that funding, you can't coordinate the effort.
No, you can't do it at all. It costs money even to have volunteers.
What I want to do, we're going to go to the telephone, and then we're going to go back to Mr. Johnson. And so hang on here, because I'm going to ask you about what, if Santa Claus came down this Christmas and presented you with money, what would the money be used for, and how could we really make it effective?
Absolutely.
But you hang on, because we got Mark from Pelham Parkway who's on the telephone with us. Hi, Mark. How are you?
Hey, Gary. Ladies and gentlemen, let me turn on my TV. I'm just going to... I
Leave
have
it
a
on,
comment
though.
to make. What I see systemically is this doesn't surprise me what they're doing with the Bronx, because the Bloomberg's administration's been doing this to the Bronx consistently. When he wanted to go for congestion pricing, it wasn't for congestion pricing to raise money for anything. It's to keep us out from Manhattan. And it's systemic. My only question is, when I see these atrocities that go on, especially since this is federal money, how come they're not dragging Bloomberg into federal court and suing him and with all the Cardozas he's got and tie him up in court? Because only he, when he ran and he overturned everything that the people voted for, not once but twice, that he could save New York, he's put New York in the worst predicament I've seen it since I've been alive.
Out of all the questions you've asked, that's maybe among the best of them. Thank you very much. So it's an interesting question that if our federal officials, congressional people, are partly responsible for getting the funding for the city of New York,
That's correct.
should they or should they not be at the forefront of making sure that it goes to the borough of the Bronx?
Well, I certainly think they should. I mean, our local Congressman Serrano, is on the Appropriations Committee.
Is he aware that this is what's been going on?
Yes.
Okay. So
I mean, there was a huge controller's report when Thompson was controller. There's been reports. There's been demonstrations. There's been, right now, there's an official complaint which the Department of Investigation of the city is investigating, and there is an official complaint into the Inspector General of Health and Human Services, which is, the federal department that is supposed to oversee this money,
Right.
and they've made no response. But I mean, he's right.
Right.
It should be in federal court.
Should be coming out.
Yeah.
And before we go to Mr. Johnson, ask that very probing question that I asked before. In terms of the city council, I kind of cut you off before. Why don't, or is the Bronx delegation focused on this, and can they advocate for more AIDS funding?
I don't think the Bronx delegation is properly focused on it. There should have been hearings in the city council, when this started.
Right.
And
Well,
there's-
maybe now some of them will hear us talking about it and say, you know what, it's something we ought to do. If you had funding, characterize the amounts of, I mean, obviously you take as much as you can get,
Sure.
but characterize an amount that could have impact, and then if it did have impact, what would you do with that?
Well, what I would say is right now is always based on what our consumers' concerns are. And as I said, we've done surveys in the past, and there are three major areas, even though there's a long laundry list, but there are three major areas that we have concentrated on that's been more prevalent than ever, which is housing for the formerly incarcerated and substance abuse. We would love to see...
Let's just be clear, housing for the formerly incarcerated?
No, housing in general for people living with HIV or AIDS, better
Okay.
housing.
Right. And then what'd you say about people with substance abuse?
Formerly substance abuse, I really feel that it could be...
What's the relationship? It may, for people like me who've been telling this story for many years, we know what it is. What's the relationship with the substance abuse and people with HIV and AIDS?
Well, actually, sometimes it goes hand in hand.
Because of needle sharing.
There are needle sharing and other issues. But my concern is if I had a wish list, it would be those three areas. For housing, for substance abuse, and formerly incarcerated, because some people were discharged from jail, there's not a discharge plan, and sometimes creates recidivism. We want to make sure that those people, there's a plan for these people to get out of jail. They don't just run to go to an SRO. There's a place to house them that's adequate to help them.
Who's getting HIV now? And then we assume in some cases it ultimately
You're talking about the
goes to-
gender, in terms of gender?
Yes, just give me and give our viewers a profile. Who's getting it now in the Bronx?
Well,
I mean, I
basically-
can tell you what it was 10
Bas-
and 12 and 15 years ago when we first covered it.
Basically,
But who's getting it now?
Basically, it's it'll be the ages between the ages of younger,
Younger? Still?
younger still.
Are there senior
But
populations?
There's
where
senior
senior
population who have had the disease for a very long time, but there's a number of there's a percentage. As I told you before, I didn't have the data, but there's a percentage of people who are middle-aged and are infected with the disease.
Do you want to give us a profile or some profiles? I don't want to
Yeah,
overly stigmatize it.
The Bronx has about 3 epidemics. It has a heterosexual epidemic, and that includes, as we go along, men getting HIV heterosexually. It has an epidemic of young men who have sex with other men. Many of these young men are homeless, etc. And then it also has a combined proly or formerly incarcerated. I do have to say that it's kind of a policy of the state to send a disproportionate amount of people who are being released from prison to the Bronx. In our own zip code, 10455, we have 9% of all of New York State parolees just in our one zip code.
To drop them off in the Bronx.
So now, don't let me get, they don't all have HIV.
Of course.
But it's about, I would say, between 6 and 10%.
And the reason this
do.
population, of course, we know about the factors of poverty and other things, but the reason this population, the numbers are so high is because they came out of prison with it? Is that what we're suggesting?
Yes, and they probably entered prison with
Now, what
it,
about another population is children? And where are we at in children? Are these children of people who had HIV and AIDS? Characterize where we're at as far as children.
Well, where we're with children getting HIV is one of the great successes. If women are treated at the end of pregnancy and for a few weeks afterward with the ARVs, the new treatments. The chances that their child will get it are almost zero. So we only have...
So we've done better.
Yes, so we only have a few children born every year with HIV, but we do have this large population of kids who are living either, like in our mentoring program, a third of the kids are in foster care because the parents are either too sick or they've died.
Right.
And this, somehow in the United States, we give, and we should, but we give to orphans overseas. We have absolutely no federal, state, or city program for our own AIDS orphans.
The messages that we delivered many, many years ago was about condoms and, of course, the whole notion of needle sharing.
Sure.
Are these the same messages, Mr. Johnson, that we need to still deliver today?
Well, yes, most certainly.
Especially
I think
when we talk about
condoms,
heterosexual
we want to
populations?
continue to spread the word about the condoms, making sure that people protect themselves and protect their partners, because that's a way of sort of the best way we know of preventing the actual disease, yes. And the needle sharing, I guess, it's not as prevalent as it was before, but it's still a concern.
The difference.
Yeah.
Talk to me about Health People. What is Health People? Who are Health People? And what is this organization?
Well, Health People actually started in 1990 as a women's AIDS peer organization to train women who are either HIV positive or had AIDS in their families to become community educators for prevention and support. And this turned out to be so powerful. I think it's very important when you mention other diseases like diabetes and asthma. One reason this community money is so important, as I said, is because people, not just us, have used it to train local educators who really represent the community, and they're very effective. We also went on, we've done that for diabetes. We have a diabetes care course. People's blood sugar goes down.
So you've expanded Health People over the years to kind of move with the changing issues in the Bronx, health issues.
But AIDS was really the impetus, because you saw before your eyes people who, conventionally would be considered outside society, who the conventional opinion would never become volunteers or dig in to help their community. Hundreds of them did. That's why we have any control over the epidemic in New York. And you know this yourself.
Of course, yeah.
The level of outreach, volunteering, becoming educators, it's not really recognized, but it gives you a lot of hope.
It is ironic to me that you're both from kind of advocacy sorts of organizations. Mr. Johnson, let's talk about, you talk about coordinated care. Yeah. Are the large medical institutions in the borough of the Bronx, and we know we have maybe some of the best in the world throughout the borough, are they engaged in working with you in helping to coordinate the care? Or is, unfortunately, this problem still reliant on advocacy groups like yours?
The uniqueness about the Bronx HIV Advocacy Network is that we conduct these forums like bi-monthly, and we try to get speakers, we try to get professionals, medical professionals, we get the elected officials, we get people in the industry that knows about this subject very well, and be able to share information that's sort of vital, very important to help people in their life be educated to make
So you are really the coordinators of this, whereas
exactly.
there may be
We're like a
providers
conduit.
and there may be medical facilities and
Sure.
there may be service providers, et cetera,
Yeah.
but you're the one to say, you know what, let's put this together.
Yeah.
Give me, I'm going to ask you for a political message in a moment, but I want you to give me a very important message to somebody who may be watching who either knows somebody who is infected or they themselves are infected, and there's still a stigma attached. They're still not sure what to do. They're not sure if they can get care. What can they do to get care so that they can get the treatment that they need and deserve?
Anybody in this country today, if they're an American, they live in America, even they could be a foreigner, there's always opportunity. For example, as long as people have have access to Medicaid, they can get benefits through
I meant
Medicaid.
even more specifically, who do they call? They call you folks? Can they call?
Well,
the
they can call us.
advocacy
We
network?
have information, and we provided that phone number, and
And
we
it's
will
up
be
on
able.
the screen, folks.
We'll be able to lead them in terms of giving them information that could be helpful and sort of a life of managing and helping, taking care of
And
the health.
I'm assuming where necessary, it can be anonymous and it can
Most
be private.
certainly, it's
And
always confidentiality is always key.
we always want to just encourage viewers and people in the Bronx, if you have a problem, find somebody to talk to. We have wonderful organizations
Yeah.
like this, so don't sit back and let it become worse than it is, especially nowadays where the care is out there. Let's
Absolutely.
get people cared for.
Sure.
And for you, Ms. Norwood, we have this email address, fairaidsfunding@healthpeople.org, for people who are interested in
And wanna join in fighting
kind
it,
of this
yeah.
advocacy. Talk to me about what's next in this. I'm assuming you're not just giving up the fight and saying, well,
No,
we're not getting the funding.
No.
How did I know?
We'll continue trying to have the city council live up to its designated responsibilities under the city charter. Also, if people email fairaidsfunding@healthpeople.org, we'll be doing another probably right before Christmas. We've actually done overnight fasts outside the mayor's house, and we'll be doing another of those.
Right. You can find out about all that. Healthpeople.org is the website. And for you, Roberto
The
Johnson.
Bronx, our website is under construction right now. It will be up and running in a couple of days, but it's Bronx HIV Advocacy.org. Yes.
Both of you, Roberto Johnson, Chris Norwood, thank you so much for joining us on Bronx Talk.
Thank
And
you
make
for this
sure that we
opportunity.
talk about very important issues in the Bronx, and don't let anybody get swept under the rug. If you have further comments or questions on anything you heard on tonight's show or anything going on in the Bronx, then email them to us at bronxtalk@hotmail.com, and we'll read those on the air during a future edition of our program. Archives of Bronx Talk are available. You go to bronxnet.org, you click Bronx Talk on the right-hand navigation bar. Next week, December 5th, should be a special night as we feature the new updated film about Big Pun and his legacy in the Bronx. And should be very, very interesting. We're going to show a clip of the updated film, and it's called Big Pun, The Legacy. And all the people in the Bronx want to be part of that. Bronx Talk, Monday nights at 9 on BronxNet, Cablevision 67, Verizon Fios 33. Thanks to producer Jane Folloro, director Michael Arias, our cast of thousands who are around us in the studio and up in the booth. And to you, good night.
Big dreams and good grades aren't enough to get into college. There are actual steps you need to take. Finding someone who can help is the first and most important. For the next steps, go to knowhowtogo.org.